Hello and welcome to Fleetful. Today we are going to talk about a very emotive subject, supporting dogs with cancer. Can diet make a difference? We are incredibly fortunate to be joined by Dr. Clare Knottenbelt, who is someone who I've seen on other videos speaking so passionately about canine health. Claire is an RCVS specialist in small and animal medicine and worked in the medicine and oncology departments at the University of Glasgow for 18 years. Now, Claire, welcome to the Fleetful channel.
Lovely
We
to
are
be here.
overjoyed to have you with us. What is cancer in dogs and how common is it, and what types of cancer are we seeing?
So, cancer in dogs is very similar to cancer in people. So, it can range from anything from a little lump right up to sort of extensive cancer throughout the whole body. You might think of that as cancer that's spread throughout the body. So, very like humans, we know that dogs share human environments, and so therefore they are prone to getting cancers as well. And we know that because both humans and dogs are living longer, we're seeing a lot more cancer. So we think it's in the realm of 1 in 3 dogs will get cancer in their lives, and probably anything up to almost 50% will die of a cancer related disease. So it's very highly prevalent. Sadly, that's very, very similar to humans. We know that probably 1 in 2 or 1 in 3 of us will get cancer in our lives. Many of us already know people who've had cancer, they might have recovered from it or who've sadly died from it. So there's a hell of a lot of cancer out there, okay? And there is a very, very wide range of tumors. And I think that's one of the biggest challenges that people forget. They think, oh, my dog's got cancer, but there are so many varieties of cancer. Basically, you can have a cancer of any organ in your whole body, including your skin. Skin is one of your most important organs. So any organ in the body can be affected. And then depending on the type of cancer, it can either stay localized or spread to other organs within the body. So you can get a cancer in one place that then ends up being somewhere else as well. And then the type of cancer that it is really defined by the cell that's gone abnormal. So in cancer, basically what's happened is there's been a mutation within one of our normal cells within our body that our immune system has failed to pick up. It's failed to identify that it's kind of gone haywire. And if that mutation means that the cell can grow uncontrollably and to keep dividing and keep growing, then that will become a cancer. So we know in our body these changes, these mutations are taking place all the time, and most of them are being picked up by our immune systems and swept away before they cause a problem. But some of them are then escaping that system and becoming a growth. And a growth is a kind of cancer, I suppose. It's a benign tumor or growth. And we tend to think of cancer as something where it becomes more malignant, where it's kind of spreading and behaving badly. But anything on the realms all the way from that lump right up to very widespread disease could be classed as cancer.
It's quite scary, actually, isn't it? Because it's actually as common almost as we know in humans, and I guess that's because we don't actually always know or test in animals to see whether there is a cancer. So why do animals have cancerous cells then? Is there a range of different factors and reasons for this to happen?
Yeah, absolutely. Basically, we know that there is a genetic component to some of the cancers that we see in dogs. So, certain breeds of dogs are more predisposed to certain cancer types. Now, that is probably in part because of our selective breeding. So, if you take, for example, the German Shepherd dog, it's very prone to a tumor of its spleen and heart called hemangiosarcoma. So, unfortunately, by breeding for the characteristics we're looking for, we may have also bred in this capacity to develop specific types of tumor. We know, for example, boxers, pugs, Frenchies, they're quite prone to mast cell tumors, which is a very common one. So are Labradors and Labrador retrievers. You can get little Scotty Terriers, they're quite predisposed to bladder tumors. So each breed has its kind of predisposed tumor. So we know that genetics is definitely a component of this. Okay. We also know that there are environmental factors, that we are sharing the same environment as our animals. So the sun and its UV rays can cause changes and mutations and can cause cancers in dogs, just like it does in us as people. We can get skin cancers associated with exposure to the sun. We know that there's a link with passive smoking. So if your pet lives in a home with a smoker and inhales the passive smoke from the environment, then that can predispose to cancer formation. We also know that being overweight, certainly in humans, predisposes to cancer development. So we can make some suppositions that it's probably similar in our dogs, because they're very, very similar to us. If you actually look at the genes of a dog and the genes of a human, there's a huge amount of crossover and similarity. So we know being overweight predisposes you to cancer formation. And there's a lot of research taking place at the moment in the human field where they're looking to see, is it a fundamental effect of having more cells within your body? Because when you're bigger, there is more cells to potentially mutate and to get missed. But possibly more importantly now is they're maybe thinking that perhaps the immune system is part of this problem, because when you are overweight or obese, your immune system doesn't work as effectively. And so therefore you've got more chance that those abnormal cells are going to escape the immune system. So what else do we know causes cancer in humans? It's things like diet. So we know, for example, eating a lot of red meat or processed meats can increase the risk of cancer as well. Now, we don't have that hard evidence yet in the dog, but we can make suppositions because we know that they're very similar to us in many other ways. So it's highly likely. Now, that's one of the challenges with cancer, is because there are so many factors that can predispose to a cancer development. It's very difficult in a single individual patient to say that's what did it. Okay, so if it's a genetic cancer, then we can say, well, yeah, we kind of were expecting that because of the breed. But we are seeing some quite weird cancers these days, some very unusual ones. And to be honest with you, quite a number of times when I'm consulting with people, the people themselves or someone in the family may have had cancer as well. So, there is certainly appearing some sort of link, that in certain areas particularly, they seem to be more predisposed to cancers. So geographical areas, maybe areas with more environmental pollution and so forth.
That is fascinating, and I know obviously there's still a lot of work and research to be done on that, but that really, really is fascinating, and it does kind of show that there's no one answer. It could be many different types of things, but obviously it's really important for us to try and support dogs with the things that we can control, which is diet. You did mention diet earlier there, and obviously it's one of the questions that we want to talk about today. So we think we can control the diet. How does diet and nutrition, or how much do you know how much diet and nutrition actually impacts cancer cell growth in dogs?
Yeah, so there's lots of different things going on in the sort of the cancer nutrition field. Okay, so we know, for example, if we take some of the reasons why we get more cancers, so being overweight, for example, if you can control a pet's weight, then that is going to help reduce the risk of cancer formation. It's not necessarily going to take it away completely, but it would potentially reduce the risk. The other mechanism, which we didn't touch on earlier, is this concept of inflammation changing to cancer. And this is a very common problem, both in humans and pets, where you have an inflammatory disease and that creates more mutations within those cells, and then that can result in cancer formation. And that's the experience I had with my last dog. He had thyroid problems, and he had thyroid inflammation initially, and then it converted into being a thyroid cancer. So with diet, if we gauge our diets right, we can try and control inflammation within the body. We can also use things like antioxidants to try and basically lower all the inflammatory changes within the body and make our body generally more healthy, which means we're less likely to get mutations, and also it's going to support our immune system as well. Okay, so what we can do is try and keep our pets on the slim side, and we can try and make sure that what we're feeding them is really going to support their immune system and dampen down any inflammation within the body. Now, the most kind of common sites of inflammation in the average pet is going to be your skin, and it's going to be your gut. Okay, so there certainly seems to be an association with dogs. There has been one study that's shown that dogs with allergic skin disease are more likely to develop mast cell tumors. So that's a clear link there. And similarly, with bowel disease, you can get changes in inflammation. So you might see chronic diarrhea or vomiting or just kind of going off their food intermittently. These things indicate bowel disease, and we know that there is probably a link between bowel disease and cancer formation in the future as well. We also see it in the bladder. It's important to remember that your bladder is actually helping you excrete toxins. So we know that toxins are coming out in your urine, and quite often you'll get development of benign growths or polyps and inflammation within the bladder, and those will eventually convert into something more sinister, to an actual form of cancer. So what we really need to aim to do with our diet is to keep our animals a good healthy weight, and then we need to make sure that we kind of reduce inflammation wherever we can. We want to make sure that we're not ingesting any sort of toxins, pesticides, things like that that are going into the system.
Sure. So if you think about that from just looking at what's the nutrition talking about. So we've got I mean, some people might say that red meat is more inflammatory than, say, a whole food diet. So is that what you mean when you say eating things that are
Yeah, I
less
think it's
inflammatory?
Yeah, I think my personal belief is that a plant-based diet is probably better than a meat-based diet, okay? And that is pretty much across the board. And the reason for thinking about that is we know that that's the case in humans. We know the more plants you eat as a human, the healthier you are, and it reduces your risk of disease, it reduces the risk of being overweight, and it reduces the risk of cancer. So we know that in people. That's a given. Now, there's a lot of interest in trying to really focus a diet for dogs with cancer, okay, to try and kind of promote certain aspects of cell growth. That is interesting. It's still a wee way off, okay, but what is important is that we can promote better health by not ingesting things that are not great. So, for example, red meat. We know in France, and the French are very big on their red meat and their processed meats. They have identified red meat and processed meats as carcinogens in humans. Okay, so we know that these are carcinogens. All right, they put additional pressure on the kidneys. We know that it's too much protein, and it basically swamps the kidneys, and it can predispose to problems with the kidneys in later life. And that's on top of just this general impact on health. So, avoiding the kind of real meaty diets, okay? And I think this is a big problem for most people, because people think it's a dog is a wolf. Okay, and that's the association people like think. They just think, oh my god, it's my little wolf. But we have domesticated these for thousands of years, and dogs are very, very different. And what dogs can do, which is amazing, is they can smell amino acids. So they can actually smell the building blocks of the protein. And when they smell a nice steak, okay, it's the same proteins actually as you might find in a baked mushroom. So they can't really tell the difference, and that's why sometimes we can't wonder why our dog's gone out and eaten a poisonous mushroom in the garden and caused much consternation, because they can smell the protein building blocks in that mushroom, and they think that that's like a steak for them. Okay, so for them it's less about the visual appearance and more about the smell. Okay, so we as owners tend to like a visual appearance that looks attractive, and that is something that the way the pet food manufacturers sell products, that's how they do it. They make it look pretty for us. It's not particularly viable. It's just they don't care. I mean, a dog doesn't care if it comes out in a little jelly and it's got cute little things and you can put a little bit of parsley on the top. They don't care about that. They care about what they can smell, and that's what's in it. What are the building blocks that they need for their own bodies?
Say there's somebody here who has done a little bit of research, but not fully, and by the end of this video they will definitely have done more, but who aren't ready to, maybe commit to a fully vegan diet for their dog. Because you're talking about all of the pesticides, and obviously Fleetful, we're a brand who are, as organic as possible, because we really do, I eat organic, Fleet eats organic. It's important for me. It's something that I truly believe in.
Mhm.
So to try and minimize all of those pesticides and environmental kind of, things coming in from the food, what if somebody was to feed, organic? And this is awful for the environment, by the way, because imagine if all of the 12 million dogs in the UK were eating an organic grass-fed beef diet, it would just be a
Yeah.
catastrophe. But let's just have a look at the health now for dogs. Imagine if they were doing
Mhm.
that.
Yeah.
Would there still be some form of, negative towards, the kind of the
Yeah.
cancer cell growth, do you think?
Absolutely, absolutely. I mean, I think it's really important to understand that, yeah, some of the, like, a lot of the work that's been done looking at what's in meat has been done in America. And America, they just do all sorts of really awful stuff. Okay. So they're injecting hormones, they're using all sorts of chemicals to make the cows grow as fast as they possibly can. And that is the real extreme end of pretty horrific quality meat. And it's no surprise to me that if you eat a lot of that, you're going to get really quite sick. Okay. So, and that applies to dogs as well. So, your grass fed organic beef animal, okay, is definitely better than the American feedlot system. Okay. That's an easy win. Okay. The animals are out grazing, but it doesn't get away from the fact that unfortunately we are eating something that's eaten something. Okay. So, no matter what you do, as soon as you have something, so you have a plant gets eaten by an animal gets eaten by another animal. What you're getting is you're getting bioaccumulation of whatever's going on within the body. Okay. So, one of the things I notice, and one of the pet bugbears, particularly of my dad, who's also a vet, is the amount of ragwort that's out in the fields. So I don't know if you've seen it, the bright yellow flowers. It's home to the cinnabar moth, so everyone quite likes it. But it's really toxic to horses, and we know that it's probably toxic to cattle as well. We don't know for sure because cattle don't live long enough to get the toxic effects. Okay, but there have been studies that have shown ragwort toxin being taken in by bees and going into honey, so there's a lot of potential out there for toxic ingestion, even if we stick organic, because we're not spraying the fields, we're not treating the animals with particular medications and so forth, but we are still needing them to get out there and eat a plant, and that plant is still going through their body. Okay. And therefore, we're bioaccumulating the toxins, any toxins from the environment. So, we always think of toxins as being pesticides. That's not the only thing that occurs in our environment. Any of you walking around the countryside just now will probably smell the smell of cow slurry being poured across the fields. We know it's running down into rivers. We know the rivers are dying because of the contamination. We know we've got sewage in our rivers. There's no way that anybody, even running an organic farm, can fully control that aspect because it's just everywhere. Okay. And, we have pollutants falling down in the rain because of all the stuff. So you can't control that, so anything, yes, organic is obviously better because it's taking away the additives and the things that we know we're putting into that product, but you cannot take away every single pollutant that's in the environment. So, yes, that would still occur on a plant, but the thing about a plant is it's not bioaccumulated. So, you've not taken the toxins out of 25 plants and shoved them into one little square of meat or one little square of liver. Okay, so it's really important to understand that anytime you are eating an animal that's eaten a plant, you are bioaccumulating.
That makes complete sense. And let's just draw it back to what we're talking about. We're talking about here the choices that we can make to feed our dog.
Yeah.
So, when we're feeding them this tiny, tiny, tiny piece of meat, which has needed a lot of different plants to be able to create, then obviously you're talking about the bioaccumulation, which is just makes so much sense to me. So So have you had any clients that you have suggested maybe a change towards more of a plant-based diet?
Absolutely, absolutely. I mean, I think the biggest example is probably my own dog, but you know, because obviously I would never recommend something that I'm not prepared to do myself. And my own dog had a mast cell tumor on his head when he was quite young, and it's been a fairly recent journey for me. You know, the last 4 or 5 years, really moving towards plant based, because as vets we get very poor education on plant-based diet. So I never had anything. I graduated nearly 30 years ago and, you know, we didn't get anything. We were just told it wasn't possible. So, you know, basically I transferred my dog because he was a little overweight and I wanted his skin health to be as good as it could be. So he basically moved across to plant-based. And what we could see was his weight improved immeasurably. So he slimmed down. He was quite a fat Labrador and now he's a slim, fit, healthy 12-and-a-half-year-old Labrador with a coat that's so shiny that people stop him in the street to say, goodness, how do you get his coat so shiny? And the only thing I do is I feed a plant-based diet rather than a meat-based diet, which we used to feed. And but in the consult room, it's a very emotive issue. So yes, I do speak to people about diet, but I'm also aware that many people don't trust vets when they say you need to change your diet. Okay. And I think this has come from many years of us being sponsored by the you know the pet food manufacturers, the big ones, and also being seen to be selling specific products in our practices. So I take a very gentle approach, okay, which is people I talk about diet, we talk about what you feed in the context of, you know, you're in my consult room, which is never a good sign because it means your dog's probably got cancer, okay? So or had a cancer and we're talking about how to stop it. So people will ask me, should I change diet? What should I do? And in that situation, yes, I would always kind of recommend moving towards a plant-based diet wherever possible. Now, we have a range of people and it's a bit like religions, and I think, you know, you need to understand that the pet nutrition world is like religions. So you've got people who want to feed raw meat, you've got people who want to feed raw plants, you've got people who want to, you know, feed a balanced product from a guaranteed nutrition. They only want a kibble. And everybody has their own view. And it's literally like a religion. It's very, very difficult to steer people who are fixed from their fixated view. Okay. But some people, a bit like us, you know, your parents are a particular religion, so you follow the religion, or your parents vote in a particular way, so you follow that. And then as you get older, you start to question some of it and make your own decisions. So a lot of people that I see are on a diet that's been picked for them by the breeder of the puppy that they bought, and they're kind of stuck on that, and they're not necessarily, they don't know what to consider, okay? And they read a lot of stuff online from their friends saying, oh, don't trust the vets, you know, they'll tell you they'll just want to sell their product. And so they don't have anyone to reach out to, and it's really, really problematic. They don't know, they're desperate to do the right thing for their pet, but they don't know what to do. So the most common one where I would recommend a change of diet would be in dogs that have had mast cell disease, because mast cell tumors are really common. And we know that once you have a mast cell tumor, you're quite likely to develop another one in the future. So we're talking about a new one, not the one that you had before. Okay. And so my view is that these things are created by inflammation within the skin. We know that there's scientific evidence to back that up. So if we can improve skin health, we hope to be able to reduce the number of mast cells that we see. And many of these dogs are also itchy. They may have, you know, intermittent tummy upsets. And when they go onto a plant-based diet, they're often actually transformed. Okay, so they change into this dog that's no longer itchy, and their coat quality is really good. Now, I can't guarantee that's going to stop them getting another mast cell, but it's the
The
best we can do. You know,
and
it's
the
the best we can do with
positive immediate changes which an owner's going
yeah,
to go, actually, I don't care if it's plant-based, it's complete, it's by a reputable company, I'm going to do it
exactly.
because it makes a positive difference in my dog.
Exactly, exactly. And we know that things like bladder tumors are predisposed in patients that have lower numbers of leafy greens in their diet. So that work was done using Scottish Terriers who are very predisposed to bladder tumours. So that work was done in Scotties that are very predisposed to bladder tumours, and they found that basically feeding more leafy green type vegetables actually reduce the incidence. So one of the challenges I have as an oncologist is by the time you've come to me, it's possibly a little bit too late, okay? Because things like mast cell disease, yes, we know that you can be cured because you can have it surgically removed. If it's a higher grade, you might need additional treatment, but you may actually get a cure from that particular cancer. So when you've got a cure from a particular cancer, then it's worth looking at all the other factors. If your dog has a terminal cancer, okay, or if your dog is having chemotherapy, heavy intervention treatment, then we just have to be a little bit cautious, because what we don't want is to get confusion reigning where we're not sure, is the problem with the dog's not eating or the dog's got diarrhea, is that because we changed the diet, or is it because of all the other things that we're doing? Okay, so that is the slight twist and problem that I have, because by the time you've come to me, you've already got a cancer, and we're trying to make a decision as to what the best option moving forward is. So generally, I'll say stick with the same. The only difference being you cannot feed raw food to a dog on chemotherapy, because there are, nasty things in there, nasty bacteria. And if we're immunosuppressing them, so we're reducing their immune system through chemotherapy, then they're at greater risk of problems.
But is there any actual research that you've been reading recently around plant-based diets for dogs and the benefits?
Yeah, I mean, basically, there's a lot of papers coming out just now, and that is really, really good to see, because there's not a lot of papers in the past for most of the diets that we've been feeding for the last 30 years. So it's quite interesting to actually see the kind of degree with which we have to prove that plant-based diets are okay for dogs. Okay, and it's slightly challenging. So the research has so far has shown that dogs appear to live longer on a plant-based diet, okay, than if they're not on a plant-based diet. There wasn't really any particular association with cancer, but a lot of these studies are too short, really, and cancer is very ubiquitous. So we know that there's a lot of research out there, and we're getting a lot of evidence that plant-based is completely safe, and that's really important for people to have that reassurance. What's ironic is that many of the diets within our sort of religion of diets, if you like, have no data to back them up at all. They have no data to say they're balanced. We have no data to say they're safe. But as soon as you suggest a plant-based diet, everybody says you have to prove it's safe. You have to prove it's safe. Okay. So we're not having to prove that raw meat feeding is safe. We're not having to prove that this particular kibble that someone has produced is safe. It just needs to be formulated so that it's balanced, but we don't actually have to prove safety. Whereas with the plant-based diets, we're having to prove safety, and we're having to prove health benefits, which we are starting to see. Now, it's interesting because there was a recent paper specifically in cancer looking not at plant-based diets, but looking at one of the pet food companies bringing in a cancer diet and comparing it to a normal diet. Okay, so this is your sort of kibble diets available from the big manufacturers. And they were looking at dogs with lymphoma and mast cell tumor, and trying to see if there was any difference in the outcomes as they went through their treatment. So they were both having chemotherapy treatment. And actually, despite the fact that they formulated this wonderful cancer diet, the main difference, the only difference really that they could find between the groups on the two diets, was there were fewer symptoms of cancer in the cancer diet. But to be honest with you, I was thinking, well, the majority of patients on those protocols wouldn't have very many symptoms of their cancer. So I'm watching this space, because for me so far I'm not convinced by that yet. But it does also demonstrate how difficult it is to prove one diet is better than the other in cancer. So I think the key thing as well is it's fine, because it might take us 10 years to prove that plant-based is definitely the diet for dogs with cancer, but that isn't going to help people today decide what to do. So if we go back to the basic science and say, well, this is the basic science and it makes logical sense, then we can stick with that. We don't have to necessarily have that full-blown study that's going to take 10 years to prove, to say it makes sense. It makes scientific sense to do this.
Well, I really like your logical approach, and it makes so much sense to me. But unfortunately, I don't even think we're there with humans, let alone dogs.
Yeah.
Because unfortunately, I have had cancer in my family, and I know what people are being recommended to eat, and I know what they serve in hospitals. And I just think, goodness me.
Absolutely. I mean, we have got a long journey, and I think one of the biggest challenges is that meat is cheap. And, especially cheap meat is cheap. Okay. We maybe have to ask ourselves, do we really want to be putting something cheap in our bodies? And it was actually my kind of transition for my dog was the reality that I was feeding treats from the supermarket, and he was having a couple of treats for breakfast. And my good friend Ariel Griffiths was talking to me about what was in the treats, and I realized that they were nutritionally valueless, and they were sort of sprayed with something that was truly repulsive. And I thought to myself, I wouldn't do that for my child. I like to feed my children healthy diet, and it's really funny. My daughter said to me today, she said, "Mum, when I go to my friend's house, they have a house full of snacks, things that you can just eat." She says, "The problem with our house is we have a house full of ingredients." And I really love that analogy. They have a house of snacks, we have a house of ingredients. So you can make a snack and you can create a snack, but it requires some thought. So you're taking the original product and you're making it. And this is what we need to really think about when we're feeding our dogs. It's really easy to go down the shop and buy a big bag of, treats, but what's in it? And is that really what we should be feeding our dog? What's in those treats? Is that something we really want them to have? So I think it's really important that we remember that analogy, that would I feed my child what I'm feeding my dog, or would I not? Knowing what we know. Now, I get it that some people don't want to give up meat, and and don't want to give up meat for their pet. But at the very least, push yourself to the absolute bounds. Make that portion of meat as small as it needs to be, the tiniest amount. And that's better. That's always going to be better than sitting down to a big plate of meat. Okay, so even if you can't commit to the sort of full vegan lifestyle and the full vegan diet for your pet, at least take a step in the right direction and try and increase the plant stuff. Because I find, I thought that my dog would be smellier on plant-based, fart more, all of that sort of thing. Absolutely not. I can tell if my husband snuck him a bit of meat straight away, because the farting starts immediately.
There's bound to be people out there watching this thinking, do you know what? My dog's got a lump, or I, just, I feel like I really, really just want to talk to Claire. Is it possible that they can get hold of you?
Yeah, so basically, I run my own business that supports vets out in practice to deliver the best quality cancer care locally. That's something that I've always been very passionate about. So through that, there's a number of ways you can access me, if you like. So all of them, you do need to come through your vet, and there is a reason for that, which is I need to know what's been going on. It's not enough for me to just hear it from you. I need to know what's going on from your vet, all the results, etc. And it's also about being professional. So when I work with individual patients and clients, I report back to your vet so that they know what they're doing. Okay, so that might be report back and say this is the treatment, might be report back and say no, you don't need to do anything else. But basically, there are different options. People can do teleconsultations with me, so they can reach out through my website, Hawk and Dove Vets, and if you look there, how we can help section, you'll find out how to request a referral from your vet. Okay, and basically they can just ping me through all the stuff, and then usually do a Zoom conversation or a telephone conversation going through what's been going on with the pets, and then seeing what the best option is, and supporting you. Because for some people, the best option is not to do anything. For some people, the best option is to do everything. And it's not about judgment. It's about making sure you've made the right choice with your pet very much at the center. If that's not something that you can afford, then I can also provide just straight advice to your vets, which is a more cost effective way because I advise them and they advise you. So it ends up a little bit cheaper to do it that way. If people still want to get advice from a specialist and get help for their pet. So there's lots of different ways. I do face-to-face consultations, but they're mainly based in central Scotland. So unless you're prepared to travel up that way, I appreciate. I don't want your pet with cancer to have to travel a long distance. Okay, I've been through that journey myself. I know how stressful it is, and so I want to make that process as really stress free as it possibly can be for you.